My name is Sara. I'm 67. I'm mother of 4. I have 11, soon to be 12 grandchildren, and I am a survivor, 2 years in remission now from colon cancer and a cancer-related thrombosis. Survived that as well. Life before cancer was very different. I had been working until I retired in a very busy GP practice. Before that, I'd been working with emotional and behavioural difficulties in secondary school children. And prior to that, I'd been working in a prison environment, in a therapeutic prison with sex offenders. So, yeah, I like a challenge. I actually retired to look after my daughter's first child, and she was needing to return to work, so I decided that would be a nice thing to do, get to know my little grandson rather well. And I'd got aged parents, and they needed some looking after too in their 80s. And in fact, I did look after Jude for about a year, and then my mum, who'd been getting rather unwell and tired, was diagnosed with stage 4 small cell lung cancer. So it was time to switch bases, and I moved to look after her and my nearly 90-year-old stepfather, and to try and make, whatever time they had, as we were told probably about 9 months, to make their time together as easy as possible. My life did change. I'd been called for a follow-up colonoscopy. I actually knew the endoscopist, and we were chatting away during the process when we both saw the tumour at the same time. Yeah, life changes in a heartbeat. Before I'd even left the hospital, I'd seen a Macmillan nurse and got lots of contact numbers, and made sure that there was somebody, a friend was called, to take me home. It was all appointments and scans and blood tests and one thing after another. But Mum was needing some treatment, and I knew that I'd got to split myself between what I needed and what she needed. My treatment was surgery. My daughter had flown over from Australia, which had been a real surprise and presented to me as a surprise. At the end of May, on my birthday, they removed 27 centimetres of colon and more than 20 lymph nodes, and yeah, I came to and suddenly realised I didn't have cancer anymore, and it just felt absolutely wonderful. I felt pretty grim after the surgery, but kind of thought, that's it, that's behind me. I've just got to get better from this. So all very positive, and I made myself get up, walk around, do all the things you're supposed to do in the hospital, and yeah, I got out within 3 days. 2 days later, I was back in hospital with a massive infection and a colonic leak. I was another 2 weeks in hospital, but I still didn't have cancer, which was pretty good. My biopsies had come back showing that there was no spread, which was marvellous, but there had been some invasion into the venous and the lymphatic system. So yeah, that was when the adjuvant chemotherapy was recommended. When I had chemo, I thought this was going to be a really, really tough time, but my family, my daughters particularly, made it a heap of fun, and we just ended up in fits and fits of giggles. I was called Chemo Ninja by my daughters and my goddaughter. I got pushed off the bed so that they could be the patient. They, kept up the support, taking me to my sessions. Yeah, much needed, good fun. I'd noticed that I was becoming a little bit short of breath and quite uncomfortable with it. I was a little bit concerned because I'd kind of read a lot of things around breathlessness. So I flagged it up to my oncologist, and he said that, because I wasn't short of breath at rest, that he didn't feel that there was a problem. In fact, I've got a quote from my clinic letter from seeing him.
There is no shortness of breath at rest, no chest pain, cough or hemoptysis, and on examination the chest was clear and there was no ankle or calf swelling.
I thought, well, yes, it's reassuring, but it doesn't take the breathlessness away, and it doesn't actually explain why that should be. But yeah, I was more concerned about the chemotherapy, the effect that it was having. My mum was really becoming extremely ill by that time, and I was trying to cause her least distress, so I just went with it. I went again to see the oncology consultant, to be cleared for the next round, and again I flagged up the breathlessness. By then, Mum was really very poorly and she was in the hospice. So I wasn't in a fit state to pursue it at that time. And in fact, Mum passed away on my stepfather's 90th birthday. And in November, I took a friend along who was concerned about my breathlessness. And I felt that if she was there saying, I am concerned about how Sarah is, then, it wasn't just me. It had been noticed by somebody else that it was increasingly bad. And a very eminent consultant said that it was due to fatigue and loss of fitness. That's what the clinic letter said when I received it as well. And I remember leaving that appointment and hardly being able to walk down the corridor. We had to stop 3 times to catch my breath, and I could hardly walk in the car park. And 10 days later, I was back on the oncology ward with a large pulmonary embolism, neutropenia and biliary sepsis. I found out while I was working at the GP practice that there was an oral anticoagulant that you could take. So I asked if that was possible, and was told that I'd be having heparin while I was in hospital. And that was a point at which I asked if I could see a consultant haematologist to discuss options. And yeah, life changed again in a heartbeat. Delightful consultant arrived, and they were looking for me and I was looking for them. They were looking for people to be on a Select D trial. And yeah, I was hopeful that I could be chosen for the oral anticoagulant. And yep, the computer of fate the oral version for me. And the bonus, of course, of that is that you get all the support of that consultant, you know, who's heading up the trial, and the research team, which is how I come to be here. I took the anticoagulants for the full 7 months before I stopped. But yeah, I was about to learn that cancer has really long arms and they gather you back in. And I started to feel really unwell again. I had a lot of pain and abdominal swelling, which was being investigated, and I had scans. So my GP had sent me for the CT angiogram, and that came back showing chronic pulmonary embolic disease, which I'd never heard of. And just that word chronic just took my breath away, because you know, chronic, that's like lifelong. You know, what does that mean? Where did it come from? And you know, I learned that that had been left behind after the PE that I'd had. But yes, I had no idea that these cancer-related difficulties would be part of the future without cancer. I've spent a lot of time, you know, thinking about that and wondering, you know, what I can do as well to help other people, as well as what can be done. The information is there, but I think some of the stress on what to look for and how to flag it up, I'm not sure that as a patient we're always able to be strong enough while you're going through that experience. I found, because I was definitely affected by chemo brain, and you know, I didn't have the energy, I couldn't find the words, I couldn't find the insistence. You know, I feel this needs investigating. It's very hard to find those words. Things like pulmonary embolism leave such a... They continue to play such a big part of your life, which isn't congruous with your recovery. So I'm sorry, everybody, that I can't be with you today as originally planned. Unfortunately, travel insurance is not possible, and yeah, I hope the rest of your conference and all your instructional sessions go really, really well. And yeah, we've got to get the word out urgently.